Hello, everyone. Thanks for joining us today. Happy Friday. This is Mike Geringer from Mentor, the National Mentoring Partnership, and we're happy that you join us for this special webinar through our National Mentoring Resource Center project in partnership with the Office of Juvenile Justice and Delinquency Prevention. And very excited about today's presentation. This is the second half of a two-part series all about the Mentoring Enhancement Demonstration Program, which is a major initiative of OJJDP's that just recently underwent a rigorous evaluation that we'll be hearing more about today. And today we're talking about the outcomes of that evaluation. And I'm very excited to have our guests with us today and unpack the findings and figure out kind of what we learned from this major piece of work. Our presenters today, we have two folks with us today. Tom Keller, who is the Duncan and Cindy Campbell Professor for Children, Youth, and Families in the School of Social Work at Portland State University. And we also have Roger Jarjura, who's a Principal Researcher at the American Institutes for Research. So thanks for joining us today. We also will hear a little bit from Jen Tyson with the National Institutes of Justice, who was instrumental, I think, in getting this project funded and implemented over the last 5 or 6 years. So a great couple of guests today, and we're really going to learn a lot about the outcomes and kind of what happened in real life when a bunch of programs around the country tried to enhance what their mentors do in terms of teaching and advocacy for the young people that they work with. Just a few quick housekeeping things today. As you can probably guess, for our attendees, we've muted everyone's phone lines for kind of good audio quality. We are recording this session, so hopefully that will help give us a nice clean recording. But you still have opportunities to interact with our panelists today and ask questions. You should all see a question panel and the kind of the controls of GoToWebinar on your screen. And so we encourage folks to type in questions there, and we'll pause about halfway through today's presentation and go through questions we've got to that point, and then we're hoping to leave some time at the end as well. As I mentioned, this is being recorded, and the slides are going to be shared, and a video of the recording will be shared after the fact early next week. So don't feel like you have to take furious notes as we go through this. You'll be getting all of this content emailed to you directly early next week. So I think at this point, I'd like to turn things over to Jen Tyson to just say a few words about the project here and kind of about why it was so important for OJJDP to make this investment. So thanks for joining us, Jen, and curious to hear your thoughts about this work.
Great, thanks, Mike. So hi, everyone. I'm Jen Tyson. I'm currently with the National Institute of Justice, but just as way of background, throughout the sort of life of the Mentoring Enhancement Demonstration Program was at the Office of Juvenile Justice and Delinquency Prevention, and so worked closely with both the programs and the evaluators on this initiative. And to just give you that really high view of sort of what the Mentoring Enhancement Demonstration Program was, is this was an effort where OJJDP simultaneously funded 10 grantees, and each of those grantees worked with 2 to 3 implementation sites, actually sort of programs that were going to be delivering mentoring, to develop new enhancements to their previous mentoring programs that would incorporate more of an advocacy and teaching role for the mentors in the program. And so their role was to sort of look at some broad research that we provided around sort of this finding around advocacy and teaching, and to actually develop the strategies to implement them in practice. As they were sort of developing those strategies, OJJDP also funded a comprehensive evaluation of the sites, their strategies, and the implementation of these practices. And so you're hearing from 2 of the researchers who worked on the evaluation, both Tom and Roger. And so, The last webinar, as Mike mentioned, I think went into much more detail about sort of what the strategies were, what the program was. But just again, at the sort of high level, this was an enormous sort of undertaking for, I think, OJJDP, the sort of uniqueness about the, how it was sort of using research, but also sort of supporting the programs to develop something new and innovative. But also, I think it's remarkable sort of the courage and the enthusiasm in the innovation that both the programs showed, as well as the evaluation team. There was a lot of complexity involved in this project. And so it really is amazing, I think, the amount of sort of effort and, good thinking that went into developing these strategies, as well as the sort of enormous and thoughtful care that the evaluators took to sort of collect an enormous amount of data and analyze it to really understand sort of what was happening and what can we learn and what were the impacts here. So what you're here today is really just, I would say, sort of the tip of the iceberg of the findings around the outcomes and the evaluation from this project. There's so much more, I think, to come to, the research team, as well as some others, are sort of going to start looking at the data, sort of trying to dive into it even more and figure out, how do we continue to learn from this, as well as even from what has already been analyzed, doing a series of publications. So today we hope you learned some about the findings, but if it's something you're interested in, hope that you stay tuned for additional publications and findings that will be coming out soon. So with that, I promised Tom and Roger I wouldn't talk very long, so hopefully I kept it pretty brief, but I'm going to turn it over to Tom, who will sort of start diving in.
Great, thanks, Jen. Mike, you want to go to the next slide? So as Jen mentioned, this was a big undertaking, a lot of folks involved. I'm going to start with the first half of the presentation and then hand it off to Roger, who was actually the leader of the senior design team and served as the principal investigator for the study. And Jen was mentioning we have already produced a very lengthy report on the project that's available online. It's about 230 pages. So as she mentioned, we're trying to summarize and pull out some highlights about the outcome findings for this presentation, but there is much more you can learn by going to look for that report. Our senior design team was from a number of mentoring research experts from different universities and from AIR, which was the recipient of the evaluation grant. And I'll just mention that we have the project leader, Magnolia Tanyu, also with us on the panel today. She might be available for answering questions. We had a team from AIR helped with the analysis, and I also want to acknowledge that we really did work in close collaboration with Jennifer at the Office of Juvenile Justice and Delinquency Prevention throughout the project, and also David Dubois, who served as a consultant, and you'll see that he was very instrumental in putting together this whole project. And then again, a team of colleagues that helped with this undertaking. So next slide. The funding was from OJJD, or the project was funded by OJJD3 through the Library of Congress, because the programmatic side was also OJJDP. They wanted to administer this evaluation grant through Library of Congress. And we take full responsibility, the research team takes full responsibility for the reporting of the study. It doesn't necessarily represent the position of OJJDP or the government. So Jen gave a little bit of this background, but I'll just share a few more details here. OJJDP is making their funding decisions based on the best research available, and they started with some findings from a meta-analysis by David Dubois and his colleagues, which looked at the factors that contributed to program effectiveness and youth outcomes. So that study of that took information from multiple evaluations across, dozens and dozens of programs, found that programs that had an advocacy role for mentors achieve better outcomes, and programs that supported a teaching or information provision role for mentors had better outcomes on average. And also mentors and youth that are matched in the program based on the similarity of interests also had better outcomes. So this was, again, sort of a correlational study, like, again, just comparing at the program level which ones were achieving better outcomes. So we saw this as an opportunity to test that, to see whether making those roles salient for mentors really made a difference. So OJDP funded programs to enhance their models by encouraging mentors to take on these teaching and advocacy roles. And the important thing is that with those collaboratives that were made up of 3 programs each, they got to determine what those enhancements would be. So they just got this general guidance to say, you know, we think it's important for mentors to do more teaching and advocacy. You can figure out a way to do that, focusing mainly on mentor training and match support. So they were not handed a curriculum or a program intervention. This was something that they generated as part of the project. And that's what we were studying, this overall process of having them try new things and see what would result from that. So next slide. So this is a way of thinking about how some of these enhancements would maybe lead to youth outcomes. So this is our overall model of change, theory of change, leading from those efforts of the programs all the way to outcomes for youth. And we'll go into this in a little bit more detail, but I'll just point at the top, the box that says moderator, and also at the bottom, moderators. Those are factors that may determine when the enhancement is more or less effective. So in other words, it might work better with certain types of mentors or certain types of youth, or it might work under certain types of conditions or in certain types of programs. So it's sort of under those special circumstances where you might get greater effects or lesser effects of the intervention. So we looked at that, as well as through the middle of that diagram, all of the step-by-step intervening processes that would lead to better outcomes. So next slide, please. We break this down looking at the first boxes. So the idea is that in these programs, they would implement enhancements to mentor training that would focus on teaching and advocacy. They would also implement enhancements to mentor support that would encourage teaching and advocacy. And as a result, the mentors receiving that guidance would incorporate more teaching into their work with the mentees, and also incorporate more advocacy into their work with the mentees. And next slide. And because of those changes in the focus of the mentoring relationship and the skills that the mentors might develop for teaching and advocacy, that would result in some changes in the orientation of the relationship toward these developmental benefits, and also might lead to stronger relationships because of the gains that would be made, and the mentees would see that they are getting that kind of support. But we also recognize that this might result in some complications in the relationship and potentially tension if mentors took this too far and made this the sole focus of the relationship, and the youth felt like they were being pressured, or too much teaching, not enough fun, things like that. And that this also could result in longer matches. And then in turn, as a result of the relationship dynamics, the youth would end up with greater knowledge about access to community resources, again, maybe through advocacy or teaching, connections to significant adults if the mentors were finding people who could help with the teaching, or advocating for their interests or their needs, social and emotional learning, community engagement, really working to develop the interests and talents of the youth, better understanding of what they were interested in. And again, as a consequence of all of that, we might see these ultimate outcomes being better for the youth in the enhancement condition. Reductions in problem behaviors, school misbehavior, involvement in delinquency, and ultimately less involvement in the juvenile justice system. And on the flip side, see more of the things that would, constitute positive youth development, social competence, improved academic performance, emotional well-being, and so forth. So that was the thinking behind all of this. And to study this, we used a multi-site randomized controlled trial. So this is the sort of the gold standard for determining causation. It's a true experiment. All of the participants that were recruited in each program, the new matches that were made as part of this program, were randomly assigned within each program. So if a program made 75 new matches as part of this program, half would receive the enhancement, receive this additional treatment, and half would do the business as usual, the control group. We had 5 years of this evaluation. A lot of it was startup phase planning and the programs developing their enhancements, and then doing the study and the evaluation of the data, the analysis. We used mixed methods to collect a lot of data, not just about these outcomes, but also the implementation that was covered in the last webinar. We had surveys for the match participants at baseline before the relationship began and 12 months into the match, and then for the parents 18 months also. We had multiple sources of data. We were getting surveys from staff, the mentors, the youth, the parents, and then we also did in-depth site visits to get the implementation data with program records and so forth. A lot of the data for the participants, the mentors and youth, was collected by staff on site with our support and guidance and training. So next slide. So these are the main research questions that we're covering in these webinars. The first was, to what extent were the enhancements actually implemented as intended? That was covered last time. And what did it take to implement the enhancements in mentoring programs? So again, what were the staffing and resource demands to put these new things in place, the new training and support for mentors? That was discussed in the last webinar. So the next questions were the enhancements associated with participant experiences and behavior, and did the enhancements have an impact on match and youth outcomes? Those are the two that we are addressing in this webinar. So just about the participants, this was a very large study. As you can see, we involved over 2,000 youth with the pre survey and the post-survey before and after their match time. We had 95% completion rate at baseline, and then 12 months later, about 74% completed the follow-up survey. And there's typically attrition over that time from both the program and involvement in the research. We saw similar things with the mentor numbers. Over 2,000 mentors were involved, and roughly the same percentages of completion at each survey. Parents, we also tried to collect parent data at that one at 3 time points, including the 18-month follow-up. Some of these were community-based programs, and some of these were school-based programs, and you see the slightly lower number for parent levels. Some of the school-based programs did not have the parent data collection. So on to the next one. So finally, what are we starting to learn from all of this? Did mentors incorporate teaching and advocacy function in their role? we found that mentors reported more frequently incorporating what we called the teaching functions than the advocacy functions in their work with the mentees. The EG, that's experimental group or enhancement group youth, were more likely than the business as usual, the BG youth, to report that their mentor was trying to help them reach goals, so that's a positive. The content of the enhancement group mentors' discussion with their mentees around goals also differed from those of the business or control group mentors, suggesting that they were more intentional in thinking about the activities they were doing with their mentees, the goal attainment, than when it was the business as usual. How did the mentors experience these enhancements? So what, this was like the usability or the user friendliness of them. The experimental group, enhancement group mentors that attended the enhanced mentoring training sessions found them helpful and used the things they were learning in those sessions. So they appreciated those opportunities and thought they were helpful. The enhancement group mentors reported significantly higher levels of agreement than the business as usual mentors to this kind of statement. Program staff have provided suggestions on what I can do with my mentees. So they were finding that enhanced match support really did mean something. They were getting more guidance on things they could do with their mentee. The mentors who attended program-sponsored match activities as part of the enhancement found that these activities were helpful in strengthening their relationships with their mentees. So again, these enhancements differed across the different collaboratives. Some focused on training, some on match support, some on additional activities that the matches could attend. So that's why you're seeing some of these different enhancement strategies being asked about. The enhancement group mentors rated their interactions with other mentors as part of their enhancements as helpful. So again, some of the strategies used by programs were to do support groups for mentors, get them together to talk about their plans and their goals and their strategies. So that was also considered helpful by the mentors. Next slide. In terms of one of those initial boxes, again, what effect are these enhancements having on the relationship? Based on what the mentor survey said, in terms of closeness, support seeking on the part of the mentee, satisfaction in the match, commitment to the relationship, and a focus on positive youth development growth, we're seeing that they're pretty comparable between the business as usual and the enhancement group on most of those. Maybe slight gains for the enhancement group. The only one where there was a difference large enough to really count as a meaningful difference is the commitment scale. So in other words, the mentors that were in the enhancements groups were reporting stronger levels of commitment to remaining in the relationship, working with the mentee, and keeping the match going. So that was in the positive direction. Next slide. So we also got information about the relationships from the youth surveys, and we asked about a number of these things here. You can see closeness, youth-centered approach by the mentor, a focus on, again, growth and positive development, relational quality, and criticism. So again, the negative side of things were measured as scales, meaning multiple items to assess those things. We didn't see too many differences again, although in most cases there might have been a slight edge on the experimental or enhancement group. The one that stands out is a single item. My mentor knows what I'm good at. We saw gains in that area for the enhancement group mentors. Then these remaining ones are single items. And again, not much difference between the two experimental groups on those particular ones. But I think it's important to note there's nothing going in a negative direction. So on the criticism, that didn't seem to come out as a problem in the relationship with the enhancement. So then finally, the perspectives on the relationship from the parent surveys, and I believe this was at 12 months rather than 18. Parent satisfaction with the relationship. So as the parent was observing what was happening in the match, there was no notable difference in that one. But the next two, mentors' provision of help to the family, slightly more for the enhancement group in that area. And that, again, might have been as a result of advocacy. Maybe the mentors were going to more school functions or helping out with other things that were noted by the parent. Also, just how the parent felt about the relationship with the mentor was more positive for the enhancement group mentors. Some of these other items, again, not much distinguishing between the enhancement and business as usual groups, but again, they're all going in the right direction, meaning slightly more favorable for the enhancement group. So now we, again, just some comments about the big ticket items, the ultimate outcomes. This kind of study, again, is a randomized control comparing the enhancement group with mentoring as usual, or as we've been saying, business as usual. So the important thing is that the control group is getting mentoring. So it's a really high bar to say, can we have all of these youth being mentored and see a difference for an incremental change with these enhancements. So it's not like the control group is getting no service at all. So it's kind of a challenge to see results from these training improvements or match support improvements when there's already a solid mentoring program in place. Another thing to note about this study is that MEDP was unique in allowing so much flexibility for the programs to design and implement these changes that we're assessing. And again, they were different across each collaborative. So again, there's strengths to that because each program, each collaborative knew its population, its program model, what they thought would work best to get more teaching and advocacy into these relationships, but there was not consistency across all of them. So, the focus might have been slightly different, and it's hard to pick up when they're each, addressing a slightly different outcome or priority. So. That said, we examined the effects of the MEDP intervention on 44 youth and match outcomes, but found no statistically significant differences either in the positive or negative direction between the enhancement group and the business as usual group on any of those outcomes. And so those are the outcomes at the far right of our diagram, things like juvenile delinquency, school behavior, social competence, all of those sort of ultimate goals that we thought might occur from this. But we were seeing differences at the early stages of that chain, but they didn't, in the 12 months, translate all the way out to some of the ultimate youth outcomes. Next one. And so why would we not see those? I think I mentioned some of those things on the last slide. There could be some other sort of methodological reasons why it was hard to detect if there were any differences between the enhancement group and the control group. For example, not every mentor that was randomized into the enhancement group actually received the intended enhancements. So again, we randomly assigned half of them to be exposed to these enhancements, but if they didn't show up for the trainings, or if they didn't have those match support contacts, or the match ended early, they were still in the group that was analyzed. So you know, that means that we got partial implementation for some of the mentors in the enhancement group. The findings do suggest that the supports were in place, the programs were implementing, the mentors were noticing differences in the training and the match support that was received. And then again, it's hard for them sometimes to turn that into actual action with the youth in the match and know how to use that information. And again, you don't know how often it would come up that there really is a need for advocacy, things like that. So there's a lot of variables involved here. And again, given the nature of the enhancements or the intervention for youth at this age, detecting major changes in their trajectories might require longer than, you know, the 12 months, the first 12 months of these matches. So again, we would have loved to see huge differences on these outcomes, but in many ways it's not surprising that that's would have been a really amazing outcome, and that we were seeing incremental improvements along the way that didn't ultimately translate to those final outcomes. But we did learn a lot about what was happening in these relationships, and I'm going to turn it over to Roger to go into more detail, where we're looking more closely at those connections we assumed in that diagram, and again, some of those moderating effects under certain circumstances where it was working more effectively or less effectively. So you ready to pick it up, Roger?
Well, Tom, I think we're going to pause real quick and take a few questions from our audience here. And we have some good ones coming in, so thanks, folks, for sending those in. You know, a couple of folks asked questions kind of about the origins of all of this, and that, you know, you'd mentioned that this idea initially came out of David Dubois' meta-analysis, which had highlighted that, you know, teaching and advocacy were, you know, kind of factors that seem to lead to stronger results for programs. But folks wanted to know, you know, was there a common definition that was shared with the grantees? I mean, I know they all got to each come up with their own kind of solutions to the challenge that was put in front of them, but did they all start from at least a common definition of what David actually meant by advocacy or teaching?
So that's a great question. The programs participating responded to OJJDP RFPs to get the funding for them to do this project, and there were some very brief explanations of what was meant by teaching and advocacy, but it was not really defined in detail, either in the meta-analysis or in the RFP. So this was one of the things we looked into as part of the evaluation, is how the programs were understanding their objective of teaching and advocacy. What would that look like in a mentoring relationship? So I think that may have been addressed in the previous webinar. It is covered in the report, and we're working to generate an article about that. But the programs were really drawing on their own experience working with matches and thinking about instances when you know, teaching might occur in mentoring and also in advocacy. I think in many cases, it was important to give the mentors permission to go into these things. Like advocacy might have involved being more involved with school, maybe going to a parent-teacher conference, advocating for the school if there was a suspension or something like that. And some programs might have said, well, that's not the mentor's responsibility, that's the parent's role. But they were sort of seeing in this project that maybe there could be ways to let the mentors get more involved and do more things that could help working outside the relationship, and meeting with other people like the parent or the teacher or others. So that's a great question. It's hard to give a pat answer on that. There was some variation in terms of what each program or each collaborative was prioritizing and thinking of as teaching or advocacy. So that's another source of variation.
Yep.
Well, if I can.
Oh, go ahead, Jen.
This is Jen, just to jump in. Because Tom did touch on this briefly at the beginning too, and just, it was in some ways, this sort of lack of it, because this wasn't sort of a replication of a specific program model, right? It was an interesting and in some ways unique approach to trying to look at research and sort of say there seems to be something here around advocacy and teaching. But what that wasn't detailed in those research studies before. And so it was sort of saying there's something here sort of thematically, there's a little bit of information, a little bit of definition on what that means and what it doesn't mean. So that was provided. But then it was really trying to sort of build that, actually establish what does this look like in practice? What could it look like in practice? What are the variations to it looking like in practice? And so some of what the sort of publications that Tom was talking about, tried to do some categorization of the different ways it looked in practice. But then, Mike, and maybe you were going to say this, I think some of what you're doing is sort of collecting the materials so that there is more of an operational sort of example of what this looks like in practice, because that didn't exist before.
Yeah, no, and we did actually have a question that was explicitly about, hey, if I want to start doing something like this in my program, are any of these materials created on the project available? And the answer is yes. We're starting to put some of them up on the National Mentoring Resource Center website in a series of blog posts written by the grantees of this initiative. So some of that, and a lot of what's kind of available now are things like little goal setting worksheets and things that the mentors would use in helping figure out, what is the meaningful work that this young person wants to do with my help. Some of the training materials, we're also looking at those to see if those can be shared. A lot of them are not in a very user-friendly format in terms of other programs just picking them up and running with them. But we certainly do have examples, and if there are things, specifically that you're looking for, you can always contact me, and I've got access to all of those materials. So we had one more question, but I think, Roger, you're going to get to it here when we start looking at moderators and things like that. April wanted to know, when we look at individual programs in this initiative rather than in total, like Tom was reviewing, were any of them seeing positive results? And I think you've got a slide that gets at that. So we'll pause on that one for now, but I want to make sure Roger has time here to get through what he wants to talk about. So take it away, Roger.
Okay, thanks, Mike. So when Tom was showed you the full theory of change diagram, and he pointed out to you, some of the that we were thinking would be moderating factors, and so we looked at 4 broad groups of characteristics that might be moderators, and so it had to do with the background of the young person, the background of the mentor, information about the match itself, and then the mentor-mentee match, and then about the programs themselves too, and their practices here. And so we ran quite a few tests for looking for moderating effects, and a relatively small number of them kind of emerged as significant. So just want to make clear that this is exploratory analysis here, that we will go back and look at and dive deeper in to look at some of these questions. And also, too, just to let everybody know that the data will be archived. We're probably still, before they're fully archived and available, probably still a year away from that. But that's also the data set will be available to the fields for others to do some analyses as well. But so here, what you're looking at in this chart here is, so the outcome measure was conflict management. So there were a number of questions that we asked the young people. These were self-report from the young people about their approach to dealing with conflict. And what you're seeing here is that when the mentor had a background as a helping professional. So let me start with the other side first. So when their background was that they had not ever been a helping professional, we didn't see much difference. So at the end there, between the business as usual group and the enhancement group, kids in both groups were about the same at the follow-up on their conflict management. But for when the mentor had been a helping professional before they were in the program, there we see that within that group, those that were the enhancement mentors, we do see a significant improvement in conflict management relative to the kids that were mentored within the business as usual group. And we saw similar results, so similar looking chart for other outcomes, youth outcomes, so positive affect, emotional symptoms, help seeking, problem solving, and conduct problems too. Always so that the mentors in the enhancement group, those young people had better results, significantly better than in the control group. Let's go to the next slide. So here here's an example of when we're looking at different program characteristics. So of the 10 collaboratives in MEDP, 6 of them were exclusively Big Brothers Big Sisters organizations. The other 4 were a combination of non-Big Brothers Big Sisters agencies here. And so we saw that when the agencies were Big Brothers Big Sisters, that the enhancement group and the business as usual group about virtually the same in terms of the length of the match between those two groups. But for the programs that were not Big Brothers Big Sisters agencies, and those included some programs that were relatively new. They couldn't be brand new programs to mentoring. They had to have a mentoring program already in place in order to be part of the initiative. But for some of them, mentoring wasn't even the primary service that they offered, and it was a relatively new model. There we see that the enhancements, the enhancement group, we did see a significantly longer match than for those that were in the control group. Okay, let's go to the next. And then what we did, so these next slides that I'm going to walk through with you. So we went back and tried to model using structural equation models, path analysis, all of the paths that we lay out in the theory of change, right? So starting with, so I'm going to walk you through from the left to right on that diagram here. So here, what this is showing here is that if the kids were assigned to the treatment group, if they were in the enhancement group, they were more likely to, the mentors, right, more likely to participate in higher numbers or hours of enhancement training. They're more likely to report that the staff supported them around the advocacy and teaching functions. They were more likely to report that the what we call enhancement related quality, so that the quality of the interaction between the mentor and the staff was more in line with helping the mentor adopt the advocacy and teaching functions. And then also, too, we looked at the number of several of the collaboratives offered mentor support activities, so a way for the mentors to be peer supports among the other mentors. And so we see that the enhancement group significantly better or more likely to have received each of those in terms of the enhancements. So those 4 boxes that are on the right side of this chart, those are what we call the enhanced practices, right? That we were looking at. So the numbers here, yeah, just one more quick thing before you switch slides, Mike. So these are standardized coefficients here. So not, you can see that they're positive, so that in the direction that we were, predicting they would be. But because they're standardized, you can see that there's you can compare the numbers to one another. So, the strongest effect here was in terms of the number of hours of enhanced training. So we did see. So you can keep that in mind as we go through. But you're only going to see a line with a number if it's a significant path. Statistically significant path. Okay, so then the next thing, so we're moving across the chart here, and so now we looked at, so for each of the 4 enhanced practices now, so we looked at whether, if they, what was the impact of that practice on whether the mentor incorporated the advocacy and teaching functions into their role here. And so first we look at the hours of enhanced training, right? And so we see that the more training that mentors got, the more likely they were to take on the teaching functions, more likely they were to take on advocacy functions. To the expanding connections is a measure, it's a scale that looks at during the time that they're together, the mentor and the mentee are together, how much of that time, what proportion of that time is spent focusing on the advocacy and teaching function. So the more training that they had, the more the higher that proportion was. And also another thing we noticed too is that the amount of time that they spent doing things for the mentee and family when they weren't spending time with the mentee, right? So these are things they're doing on behalf of the mentee and his or her family when they're not together with the young person. And so I'll just tell you, so rather than showing this 4 different times, so, remember there were 4 enhanced practices. So the other ones, match support, the enhancement related quality, and the number of mentor support activities. We see similar patterns here, all significantly related to, higher likelihood of taking on the advocacy and teaching functions. Okay, let's go to the next one. And then, so now continuing on through the path model here. So then we looked at, well, so if they adopted the mentor, so the advocacy and teaching functions, what do we know about what the impact of that on the what we call the proximal outcomes, which were the mentoring relationship quality items here. And so here we see, so when mentors reported taking on the teaching functions, they were more likely to see positive effects around growth focus, commitment, whether the young person identifies the mentor as a special adult. And you'll see at the bottom here that the match was longer too. So the match dosage here looks at how much time was there in the relationship up to the point of the follow-up data. So not the true match length, because many of the matches were still going on at the time of the follow-up data. I'll just say just quickly about the item of pressure. So this is a scale where the kids were asked, I wish my mentor wouldn't, talk so much about this, or, these were items that really got at the kids feeling sort of pressured by the mentor. So we do know this is a small effect here, but it is significant that the kids in the enhancement group were more likely to experience or report feeling pressure from the mentor. So something that we did note, from MEDP. And again, so the note at the bottom here shows that, so we see the similar patterns here if we swap out teaching functions for advocacy functions, or the expanding connections, or time doing things for the mentee and the family. Let's go to the next slide. And then here, so then what we looked at, so from the past models, so then we looked at, well, what was the indirect effect, right? So the treatment condition, which is all the way on the left-hand side, so it only influences the outcomes through the enhancements, right, and through the mentor behavior. So those were indirect effects. And so what we see is that we did find significant effects in the direction that we were predicting for the treatment condition, so enhancement versus business as usual, on each of the outcomes, with the exception of two. There were two that we didn't find. So one of them was whether or not during the 12 months of the match, the young person who had not previously been involved in any kind of violent offending behaviors actually started, right, the onset, so that began, so that we didn't see any effect there, and also self-reported grades, basically a zero effect there. Otherwise, so it's what we would have predicted in the theory of change played out here. Now, so let's go on to the next slide. So just briefly, some conclusions here. So again, and this, so reminder, this was the results that Tom presented. So the random assignment to receive mentoring with the enhancements. So that assignment, so that when we compare the enhancement to the business as usual group, we didn't find statistically significant direct positive or negative effects on mentoring relationship quality or the youth outcomes. So those were the main effects, right? So just comparing enhancement to business as usual, we didn't find significant main effects. There were overall significant differences in the amounts of general training for mentors and the amount of support that the enhancement mentors received compared to non-enhancement mentors. So we did find that the programs where the enhancements were implemented and mentors received those, that that was more likely to be the case in the treatment group versus the business as usual, which we would have predicted. But we didn't find, even with that, right? So overall, we didn't find within the two groups, right, that the enhancement group mentors were more likely to take on the roles, advocacy and teaching functions in their roles. So the mentors in the business as usual group were also likely to take on those roles. When we looked at the path model, then we could see, so let's go to the next slide. Then we see, that the enhancement group mentors did receive higher levels of training and support. And if they received higher levels of training and support, that was associated with improvements in match relationships and in the youth outcomes that we looked at. And we also saw that when mentors had backgrounds as helping professionals, that seemed to accentuate the improvements when they were exposed to the enhancements. And then just one more slide here to wrap up. So just wanted to highlight for practitioners what some of the implications are from the findings here, from the outcome analysis, the outcome evaluation here. So it does appear that there's potential value in having more targeted training. So the programs were charged with developing training that would, inform mentors about how to take on the advocacy and teaching functions. And so it does look like from the results that there's value in that. Although we also noted, right, getting volunteer mentors to attend trainings, particularly those that happen post-match, right, is still one of the biggest challenges to implementing the enhanced practices. And so we saw that across all of the sites, right? So really nice trainings that were developed, but attendance rates not more than what your own experiences are in terms of trainings that happen post-match. So perhaps one implication here is to consider incorporating more of the targeted training into the pre-match training, and then providing boosters along the way, which can one model for that is to incorporate some of that into the ongoing contact that staff is having with mentors. And we did see in MEDP that they were more likely to use checklists or have outlines of things they were supposed to go over with them, so that they were highlighting the advocacy and teaching functions with those regular contacts. And we also saw, and again, this is a little bit harking back to our webinar from a couple weeks ago. So the collaboratives when programs came together and worked together in a collaborative, when that was done well, that seemed to offer many advantages in terms of the design and the implementation of the enhancements. And one last point, that staffing levels, which included turnover among some of the client-facing staff, seemed key for whether programs did well in terms of implementation. And then then I think we're at a point where we could take more questions if there are.
Yeah, thanks, Roger. We've got about 5 minutes left here, so we did get some good questions coming in. Someone asked a good question around, we talked a lot about the enhanced training that mentors got. I believe I remember reading that some programs, also kind of enhanced the orientation perhaps that parents got, so maybe they could be a better ally to the work being done on the kids' behalf. But someone asked, was there training for the mentees, for the youth as well, either with their mentors so that they could, kind of both be on the same page, or perhaps a separate training about like, hey, this adult's going to start working with you in this more intentional way, and here's how you can help with that. Did you see any of the collaboratives do mentee training as well?
Yes. So this, it wasn't a requirement, so we didn't see this systematically across all of them. So I'm not sure that any of the programs did the sort of the training of mentee, like how to be a mentee in this relationship, but many of them did trainings for the mentees and even the mentor-mentee combination, right? So around goal setting or some aspect of the program where kids were intentionally included in those trainings, and a number of the collaboratives did things like that.
Great, thanks. And I can imagine that doing that kind of training with young people around good goal setting skills and how to even advocate for yourself, those are skills that will last a lifetime if done well. We had a good question about moderators here, and I think Sherry asked basically, was there any difference in some of these outcomes or the effectiveness of the enhancement, based around kind of the difficulties that the young person brought to the program, kind of their risk profile, if you will. Did you see any differences in outcomes based around who the young people, were and what they were struggling with? Anything like that, Roger?
So we did test a number of risk factors, so environmental and individual level risk as moderators, and we didn't find any evidence that moderated the impact of the program on the outcomes.
Okay, great. And then I think that's about it in terms of questions. I think one thing I was wondering that I've heard you mention when talking about this project before, Roger, was, do you have any sense of whether, because these programs had to separate youth who were getting these enhancements, mentors who were getting these enhancements from all of the rest of the program participants. Were there any worries here about kind of cross-contamination? So if I'm a match support specialist and I'm offering enhancement advice to some of my mentors, were there any concerns that maybe they'd also secretly help the control mentors, or did this have this kind of global effect on the program as a whole that might explain that kind of lack of real differences between the two groups?
So there was a range of capacity of the programs. So the biggest programs, we coach them, right? It's not quite a requirement, but we strongly recommended, right, that they have staff dedicated to either working only with enhancement matches or only working with business as usual. And those programs that were able to do that, they were pretty good at sticking with that, right? In fact, when we went out and did site visits, the staff working with business as usual would say, hey, I don't even know what they're doing, right? I don't even know what the enhancements are. They won't tell me. I'm not allowed to know, right? So they seem to really stick to that. There were some smaller programs, though, that they didn't have the luxury of doing that. And so staff we're working with both kinds, both groups at the same. There were some programs which we did. One of the programs was site-based, and so we had to randomly assign the sites to either be one condition or the other, because there was going to be no way to keep the kids and the mentors from being, from interacting with each other. So sometimes that affected the way the design, right? So we tried to control for that in the design.
Yep. And one last question here before we wrap up. Someone asked, there were some issues getting mentors to those post-match enhancement trainings. When they did show up, it seemed like it was impactful in their relationship. But, so someone asked, were those trainings presented as optional? Or was there anything in your study here that hinted at ways to get mentors to show up and participate in these types of additional trainings or enhanced trainings?
So we haven't. So we do know, the different programs took different approaches to try to, and some of them made some adaptations in terms of the way they delivered the training to try to increase the number of. And we haven't looked at those as variables in an analysis yet to see to do something with that sort of, digging deep. I would say, so the programs would tell you that these were required, right? They were expected, right? Because they were enhancements. The mentors that were in those groups were supposed to do them. But I will tell you, there were one of my favorite anecdotes. We did a focus group of mentors at one site, and we had just heard from the staff earlier before that day that they were having such a trouble getting mentors to show up for the trainings, and during the focus group, the mentors said, well, why didn't they just tell us it was required, right? I would have come if they would have told us it was required. So while the programs would tell you that it was required, I'm not sure that's how they reported it to the mentors. So the mentors didn't experience as, well, we've got to do, we have to do this. Yeah.
Well, thank you, Roger. And as you can tell, our audience here is really interested in kind of practical implementation tips. And I would just encourage folks to read the full report if they've got the time. It's large. It's definitely a big study, right? And you guys did a great job of writing it up. But there's a lot of nuance here, and there's a lot of interesting findings, both overall and at the kind of individual site level, that I think folks will find in that full report. And with that, let's go ahead and wrap up here. I want to be mindful of the time. Early next week, look for a link that'll show up in your inbox that'll have a link to this recording and a copy of the slides, and I'll even throw in a copy of that big full report for folks. If you can't wait that long, here's the link on this slide to go ahead and download it. If you just Google mentoring enhancement demonstration evaluation, you can find it pretty easily. As I mentioned earlier, we have a series of blog posts on the NMRC website that are authored by MEDP grantees, and each of them kind of tells their own story about how they went about making these enhancements and how well it worked, and kind of the long-term impact that had on their agency. A lot of them are implementing these enhancements for all mentors now, right? They found that it added a lot of value and are now moving forward with some kind of permanent changes as a result of this. And one last plug here: if this has inspired you to make similar enhancements in your program and want some help doing that, you can always request free technical assistance through the National Mentoring Resource Center. If you go to the website, there's a big red request technical assistance button, and that'll get you going on the process of getting some help from one of our expert consultants around the country. So big thank you to Tom and Roger and Jen for joining us today and presenting all this great information, and thanks to our audience for joining us. And we hope that you got a lot of value out of this, and certainly there'll be more to learn about this study in future reports and further analysis. So thanks, everyone. Have a great weekend, and we hope to see you on a webinar soon. Thanks. Bye.
Thanks, Mike.
Bye.